I'm Anna Giuliano. I'm a researcher focused on human papillomavirus among both men and women, and I also direct the Center for Infection Research and Cancer here at the Moffitt Cancer Center. So, everybody's at this point familiar with the fact that human papillomavirus, or HPV, causes cervical cancer. But what seems to be less understood and less well recognized in the community is that HPV also causes multiple cancers in females, so not just cervical cancer, as well as multiple cancers in men. And so if we look at the list, it's actually quite extensive. So among women, HPV causes cervical cancer, vulvar, vaginal, and anal cancers, as well as oropharyngeal cancers. And in men, HPV causes penile cancer, anal cancer, and oropharyngeal cancer. And in fact, if you look at the worldwide view, there are quite a few cases that are occurring every year. And in the case of cervical cancer, we know that's the bulk of the cancers we see, because most of the world is not screening for cervical cancer, so the incidence is quite high. And in those settings, half of all women who are diagnosed with cervical cancer will die from cervical cancer in that year. There are multiple HPV types. And in fact, at this writing, there are probably over 150 HPV types that infect humans. But there are only a few, this is the good news, there are only a few that actually cause cancer in either men or women. And if you look at the distribution of those HPV types, we find that around 13 to 15 that we think cause cervical cancer. But there are actually far fewer that we have definitive evidence for that cause cancers at the vulva, vagina, anal canal, and the cancer sites in men. It really kind of boils down to two types. The majority are due to HPV 16, and then we have a minority of cancers that are due to HPV 18. So in terms of preventing the majority of these cancers in men and women around the world, it's really focused on HPV 16 and 18. Now, let's not forget that HPV also causes genital warts. 90% are caused by two types, and those are HPV 6 and 11. One of the things, though, that needs to be made very clear is that human papillomavirus is one of those equal opportunity viruses. So when we typically think of sexually transmitted infections, we think of certain core groups that are at the highest risk. So that might be true for HIV or gonorrhea or syphilis. We just reviewed the cancers that HPV causes, but one of the things that's important in understanding the infection is in men and women. This is an equal opportunity virus that infects individuals in the general population. And in fact, our estimates are that approximately 80% of men and women at some point in their lifetime will be exposed and infected with human papillomavirus. The good news is very few of those individuals will actually progress to cancer or to disease. But the problem is we don't know who those would be. So the best approach, obviously, would be to simply do primary prevention. That is, prevent the infection from occurring in the first place through vaccination. The good news is that we do have vaccines on the market both in the United States and in multiple countries around the world that have really shown high efficacy. And now we finally have effectiveness data showing that these vaccines will prevent infection and the diseases that those infections cause. So currently in the United States, we now have 3 vaccines that are on the market. The first, we'll start with the bivalent vaccine, which is trade name is Cervarix, that's produced by GSK. This vaccine is targeting prevention of HPV 16 and 18. So again, the majority of cancers that are caused by HPV are caused by those two types. We also have the quadrivalent vaccine, or Gardasil, that is produced by Merck. And this has protection against HPV 16 and 18, as well as protection against 6 and 11, the two types that cause 90% of genital warts, and also likely the majority of recurrent respiratory papillomatosis. Recently, as of last year, the FDA approved in the United States a new vaccine, which is Gardasil 9. So it's essentially exactly the same as Gardasil, with the addition of 5 other high-risk HPV types that we know cause cervical cancer. So with Gardasil 9, we now have the potential to reduce 90% of all cervical cancers, as well as the majority of the other cancers that occur in men and women that HPV causes. So this is really great news. These are vaccines. When I say there's efficacy, we're talking about in clinical trials showing efficacy that approaches 100%. So these really are game-changing vaccines, not only for the prevention of this virus, but game-changing in terms of such high efficacy of any vaccine that we currently use.